Have you ever wondered why patients feel safe sharing deeply personal health information with their doctors? What makes the level of honesty possible in a medical setting? It all comes down to trust and confidentiality. I'm Kayla with Jotform, and in this video we will explain what doctor-patient privilege is, what protected health information means, why confidentiality matters in healthcare, when there are exceptions to the rule, and how providers can protect patient data while collecting information online. We will also touch on how HIPAA-friendly tools support secure data collection. Let's jump right in. Trust and confidentiality are at the core of the doctor-patient relationship. Patients need to feel comfortable sharing their medical history, symptoms, and concerns without fear of judgment or negative consequences. When patients know their information will be kept private, they are more likely to be open and honest, which allows healthcare providers to deliver better care. Doctor-patient privilege, sometimes called physician-patient confidentiality, exists to protect this essential bond and is considered a fundamental principle of medical ethics. Doctor-patient privilege refers to the legal and ethical duty healthcare professionals have to keep a patient's information confidential during treatment. In simple terms, it means that personal health information shared during care should not be disclosed without proper authorization. This assurance gives patients confidence that their private matters will remain private and encourages honest communication during medical visits. This principle applies to more than just doctors. Doctor-patient privilege extends to other medical professionals, including nurses, dentists, therapists, and psychiatrists. Anyone involved in providing care or handling patient information is expected to respect confidentiality and protect patient privacy. To better understand how doctor-patient privilege works, it helps to understand protected health information, often referred to as PHI. PHI includes any personally identifiable health information that healthcare providers or their business associates create, receive, store, or transmit. PHI covers a wide range of information related to an individual's past, present, or future physical or mental health services received or payment for those services. Examples include patient names, addresses, contact information, social security numbers, medical records, diagnosis, lab test results, prescription details, and financial or insurance information. If health information can be linked to a specific person, it generally qualifies as PHI. HIPAA requires healthcare organizations to implement safeguards to protect PHI. These safeguards include limiting access to authorized individuals, using secure methods for storing and transmitting data, and obtaining patient consent before using or disclosing protected information. These requirements help support doctor-patient privilege by reducing the risk of unauthorized access. One of the main purposes of doctor-patient privilege is to promote trust and open communication. When patients feel confident that their information will remain confidential, they are more willing to share sensitive details that may be critical for an accurate diagnosis. Doctor-patient privilege also protects patient privacy. Medical information is highly personal, and confidentiality helps ensure it does not fall into the wrong hands. This is especially important for sensitive topics like mental health, reproductive health, or substance use, where privacy concerns may otherwise prevent patients from seeking care. Another key purpose is supporting effective diagnosis and treatment. Without confidentiality, patients may withhold information or provide incomplete details, which can lead to misdiagnosis or less effective treatment plans. Respecting privacy allows providers to gather complete medical histories and deliver better outcomes. While doctor-patient privilege is essential, it's not absolute. Certain situations may require breaching confidentiality, usually when public safety, legal obligations, or the well-being of the patient or others is at risk. Common exceptions include suspected child abuse, where providers are legally required to report concerns, credible threats of harm to the patient or others, and court orders that require disclosure of medical records. Healthcare providers have a legal and ethical duty to protect patient confidentiality. They must keep patient records secure, limit access to those directly involved in care, and obtain informed consent before sharing information with third parties. As healthcare becomes more digital, organizations must use strong security measures to protect electronic health records and online data. Secure storage and encryption are essential for protecting data. Jotform's HIPAA-friendly online forms automatically encrypt data, and organizations that request a signed business associate agreement receive one, providing added assurance that the patient information is protected. Thank you so much for watching today. I'm Kayla with Jotform. Don't forget to click subscribe for more helpful videos, and I'll see you next time.